JL is a 4.5-month-old Asian American infant that presented to us with vomiting and diarrhea, which had been occurring for the past 3 days. She had had a fever and been given acetaminophen every 6 hours and currently only drinking clear liquids and Pedialyte. After the second day, she had a decreased appetite, and that is when her first watery stool was observed. In 12 hours, the patient had 8 watery stools, and they did not appear to contain blood. She did, however, begin to vomit after meals. After the sickness continued to worsen, her mother contacted her pediatrician and was ordered only clear liquids with special instructions of those liquids. The vomiting did subside after that, but the diarrhea continued as previously described. The infant's lethargy also appeared to be worse each day, and the fever continued with increased irritability. The patient does attend daycare regularly, but other than that, no social or family history was noted as abnormal. The patient did exhibit abnormal vital signs with a rectal temp of 101.5 and a pulse of 166, with the peripheral pulses being weak. She had a 10% weight loss over a 10-day period as well. During JL's examination, many abnormal findings were noted. The patient's capillary refill was delayed to 5 seconds. Her tongue appeared dry and rugged. The abdominal wall was sunken, appearing concave, and she had greenish watery stools that were observed in her diaper. The specific gravity on the UA came back slightly high at 1.029, whereas normal would be 1.016 to 1.022. Other high laboratory results indicated were the bun and creatinine, which are renal function tests, the white blood count, which is indicative of infection normally, and the ESR, which is the erythrocyte sedimentation rate for whole blood. Abnormally low findings consisted of the bicarb, which is abbreviated HCO3, and the pH and PaCO2 also were abnormally low, with an indicative diagnosis of metabolic acidosis. We then determined the patient had an acute form of severe non-inflammatory diarrhea. The most common form of treatment in patients such as this is Pepto-Bismol, which contains bismuth subsalicylate that coats and protects the stomach lining. It also works to decrease the amount of unformed stools and increase the consistency of them. Atropine, which is not an anti-diarrheal drug, is commonly added to diphenoxylate because it can cause the colon to be dilated. Diarrhea can be a serious condition when occurring in infants, so proper care and precautions are always necessary. Upon discharge, the parents of the infant expressed to us that they were currently planning a trip to Africa, an area that is highly undeveloped. We then provided them with a few tips to prevent diarrhea due to the unsanitary conditions to which they will be traveling. First, proper hand washing and etiquette before and after meals and bathroom use is always a must. Also, to avoid eating any fresh fruits or vegetables, as they may not be washed or handled properly in preparation. Take the time also to buy water, and don't drink the water that is in the area. Rather, drink imported or water that you know is safe, such as bottled water. Check out areas of interest in advance for meals so that you make sure that these practices described are being used for the preparation of the food that will be consumed. If no further comments or questions, this concludes case 22 on diarrhea. Thank you.